Does this scene look familiar? Having a desk job where you get to stare at a computer screen for hours at end. Your fingers type away at a keyboard, letters and numbers until your fingers get numb. Now, having a desk job can be repetitive, boring, and very routine-like. And with that, just as I'm feeling, the physical discomfort is not very easy to deal with. I can feel it in my shoulder, my neck, and my back.
Hi, would like to talk today about what if you are diabetic already? What do you need to do? First of all, don't worry. Diabetes is a treatable condition, and some of them actually could be cured. We'll tell you how. Well, first of all, diabetes is a medical condition associated with elevated glucose levels. You could have either a deficiency of insulin, that's what happens in type 1 diabetes, or you could have also resistance to the insulin action. Your insulin does not really function, you cannot control your glucose very well. That's what happens in type 2 diabetes, and also in what the gestational diabetes or diabetes in pregnancy happens. So what do we need to do if you're a diabetic? First of all, you need to consult a physician who has a very good knowledge about how to manage diabetes, because he's going to be your friend. You need to have someone that you can trust, who can follow you very well and try to predict any possible complications or related condition to diabetes during the treatment period. If you're a diabetic first, what we need to do is that we need to make sure is that you don't have any other medical conditions. We need to make sure you don't have any kidney problem, heart problem, or any what we call a vascular problem, which is the blood vessels that supplies to the foot, to the eyes, to the brain, to the kidney. All these we need to make sure that they are healthy, they're functioning very well, and you don't have an issue with them. Another thing we need to make sure is that your blood pressure is good and your cholesterol is also good, because they are what we call comorbid conditions. They are medical conditions, could be also, if they happen at the same time with diabetes, can cause a lot of problems. So, and we need to control them even with medications if we need to make sure that all these medical conditions are controlled. People who have diabetes, we would like to screen what we call the retina of the eye, which is the inner part or the background part of the eye, and make sure that it does not have any blood spots, any lipid spots, or any cholesterol spots, because they are also could be the complications related to diabetes. So we would like to test the eye or examine the eye about once a year, make sure it doesn't have any medical problems with it. Second thing, we also would like to see, make sure that your kidney is functioning well, and something also we call a urine albumin level. The kidney sometimes pushes some of the protein, or what we call the albumin, into the urine in a very minimal amounts. People who have diabetes, who develop complications related to the kidney, some of them could have a lot of protein put out in the urine, and we need to screen for that and predict it, because if someone has this protein, significant amount of protein in the urine, that means he already started to have some complications in the kidney, and we need to prevent that. Also, what we do is try to examine and try to listen to the symptoms if the patient has them about the feet. The feet could carry a lot of information about diabetes. There's a lot of nerves and also blood vessels that goes to the foot. And because these blood vessels and nerves are very tiny when they reach the distal parts of the foot, these are very high risk to develop some closures and some complications, and do not innervate very well and do not supply the blood vessel, the blood level very well. So we would like to look at the feet. We would like to make sure that these feet out there, those people do not have any numbness, any tingling sensation, or any issues related to the foot care and foot health. We'll talk more about it after the break. Welcome back. So we're talking about what if you're a diabetic, what you need to do. So we talked about the things that we do as a screening, as an examination, to make sure that your health is good. Now let's talk about the management and treatment of diabetes. So if you're diabetic type 2 diabetes, it means that you probably gained some weight, your lifestyle is not very healthy, then the most important part about diabetes control is try to minimize the weight and try to control your diet. We would like you to exercise. We would like you to spend about 150 minutes a week of doing regular exercise. We would like to spend about much even more than that if you're able to, about 30 minutes, 45 minutes of daily exercise to control your weight, to control your glucose. Walking, running, jogging, anything you can do, swimming, that would be perfect. We would like to stick to a healthy diet that consumes much less carbohydrates, maybe around 25 to 30% of the meal to be carbohydrates, and try to stay away from refined sugar as much as possible, and sweetened drinks also, because are very bad for your health. So try to avoid that and try to fix it with the diet. So these are very important 2 steps that we need to do in management of diabetes. Now, we have a lot of medication to control diabetes, and unfortunately, a lot of people would require them to control it. People who have type 1 diabetes, who do not have a functioning pancreas and do not produce insulin, the only treatment that they can use is insulin, which is a replacement of the missing insulin that they don't have anymore. And the insulin could be of different types, of different dosing, and they could be variable dosing according to the day and night, and also for the meals, and that needs to be followed very well with the physician. The other types of medications, we use them a lot. There's many types of medications for type 2 diabetes, and these medications could be in pills and also could be in injections. The pills are mainly to control the pancreas, try to help the pancreas to do a better job in producing insulin and overcome the resistance that's in the body. Other pills also will help to reduce the amount of glucose that is being produced from the body itself, from the liver, because our livers always produce sugar. We try to minimize that by these therapies. Some medications also will try to block or reduce the amount of absorption of glucose from the gut. And the injections also could help in that part, where it also can help reduce the amount of glucose produced from the liver. And also we can use insulin for people who have type 2 diabetes. If all the therapies do not really work and the glucose levels are very high, so sometimes we use insulin to reduce that significantly. In people who have gestational diabetes during pregnancy, we would like to use a lot of times doing lifestyle modifications. So we try to restrict as much as possible the amount of carbohydrates, use more complex carbohydrates, and try to weigh as much as possible from refined sugar to prevent any increase in glucose in people who have gestational diabetes. A lot of times we use insulin for people who have gestational diabetes to try to control their glucose levels, and it works very well. And usually this is a temporary measure until the end of pregnancy, and then people can go back to their lifestyle, which should be healthy even after pregnancy, because people who have women who have gestational diabetes could be also prone to develop type 2 diabetes or regular diabetes after pregnancy, unfortunately. So these are very important. Most important part after all that is good follow-up and monitoring for your glucose at home, and follow up with your physician to establish the best care as possible. Wish you a happy and safe Ramadan.
I was actually doing my own research. I found that sitting still for too long can actually increase your risks of heart disease, diabetes, cancer, and muscular or skeletal disorders. This has been scientifically proven. So break down your work hours with a few minutes of exercise. Get your body, get your blood moving around. It's also important to maintain the correct posture. Now I'm gonna get back to work, and I'll leave you with the tricks to keep in mind.